Hi, I'm Dr. Wanda Beddinghouse, and I'm so excited today to have an interview with one of my favorite people in the whole wide world, and that's Dr. Nicholas Dogris. Dr. Dogris is the co-founder of Neurofield Incorporated, where they have developed specialized neurostimulation and neurofeedback equipment to help restore function to the brain. He's a licensed psychologist. He's certified in QEEG brain mapping, and he's a board certified QEEG diplomat. He's also board certified in neurofeedback through the Biofeedback International Alliance. And over the last 25 years, Dr. Douglas has innovated many neurofeedback interventions and invented the neurofield neurostimulation, neuromodulation system in 2007. And that's the equipment we use here. Dr. Dogris came to our clinic several years ago and trained me and my nurse, Tom Brady, in this amazing equipment that can help restore balance to your brain. So let's welcome Dr. Dogris. Hello.
Hi, Dr. B.
It's so good to see you. Oh, this has been something I've been looking forward to. How much I appreciate your willingness to take a little time out of your busy schedule and talk to the people that we have on board here. So let's start by, could you give us a little background about how you got started in this?
Wow, how did I get started? I've been in the field. I originally started in 1988 in EEG at Humboldt State University. I worked with Dr. John Morgan and Dr. Jim Knight. They were really influential on me. We looked at P300s and ERP in the visual system, and it was just a really exciting place to see technology happen, and to see the brain was amazing to me. And being a person who's played music my entire life, the brain looked like a musical instrument. And I just had a natural affinity to that. And so I started there. And after graduating, I came back to Los Angeles and I started working for a psychologist. And I would eventually meet Margaret Ayers. And Margaret will go down in history as kind of like the mother of neurotherapy. And she developed the first patented real-time EEG device in the United States back in that time. And I had the pleasure of working with Margaret and learning from her. And she really just changed my entire perspective about mental health and psychiatry. I watched her work with people in coma and take people out of coma with neurofeedback, which just basically defied everything I had learned in my training up to that point in time. So it really, and I was going to be a prescribing psychologist, and I was looking at, moving to New Mexico and doing all that kind of stuff. And after meeting Margaret, I was derailed into this other realm of science and looking at the brain, kind of like the unknown frontier. And so
a few weeks ago, we had Dr. Penny Montgomery interviewed, and she worked with Dr. Ayers for many, many years. So this is just expansive field. So go ahead, tell us more.
Oh yeah, and I remember meeting her back in the day. So from that time on, I just continued to work. I worked in mental health hospital. I worked in psychiatry. And I was getting my training as as a psychologist, and I just got real disillusioned with the level of treatment that people were receiving. And one thing that really resonated with me back in the day was Margaret would always say that the majority of these issues that you see in hospital are brain injuries. They're not psychiatric problems. And I just remember getting really defensive about it. I was thinking, that's not true. There are psychiatric problems. They have to be. And then, all these years later, I believe she was correct. But there's much more to it now. I think there's other pieces of it that we, she never talked about that we talk about now in terms of nutrition and whatnot. But yeah, and so from there, dove headfirst into providing neurofeedback services for first children, and then I got into adults, and then necessity is the mother of invention. And my eldest son was born with a brain injury, and I needed a way to feed a baby, and so Neurofield was born because of need, basically. And
Yeah. So your work with children can you tell a little bit about the kind of patients that you've seen over the years, especially children, and your approach to helping their brain work better?
yeah, right. Yeah, I can say that honestly, worked with almost every population out there. Pretty close to it, from very young to the very old. But with children, we get a lot of children with autism,
Yeah.
Asperger's, developmental delays, pervasive developmental problems, kids with attention deficit disorder, children with reading disorders, speech disorders, you name it. We get a wide variety of children with a lot of different issues, and we the way we work with them is we start to get the information. It's all about the brain mapping. It's all about the science. Being able to bring a child in and to adequately measure the organ that we're going to treat, and to do it in a real way that matches what computational neuroscience is doing right now in the real world. That's what Neurofield's all about. We're in lockstep with academics and the real science.
Yeah, that's amazing. It's been what 4 or 5 years since you came here to Denver and helped train me and Tom how to do a EEG, get the cap on, and measure the brainwave activities, and then convert it to a brain map. Can you just talk a little bit about that process and why a QEEG, a quantitative EEG, helps not figure out what's going on and how to create a protocol?
Yeah, again, it's measuring. I always say this: you're measuring the organ that you want to treat. And that's such a key piece to working with anybody neurologically, and not to just kind of shoot in the dark based on external information. Now, the external information gives us an idea about what the behaviors are and how the person actually shows up. But when we actually measure the system, we're putting 19 channels of electrodes on the head, and we're measuring the tiny electrical impulses that the brain actually creates. And from there, we quantify that. We can actually look at 88 different regions. We can take that information and source it into a three-dimensional mesh that gives us an idea of how that information is flowing through the brain at different speeds, at different frequencies. And for instance, like when you have small children that have delays, they can have excessive amount of slow wave activity that's actually impacting their ability to process information. And when you correct that ever so slightly, it doesn't have to be this massive correction. It can be just a slight correction. Then you start to see them function better. Their functionality improves dramatically, and everybody else around them will see it. The teachers will see it. The parents will see it, and they'll come back and say, "Wow, this person's functioning differently." So what we do is we start with that brain mapping, and just recently we added a couple of different steps. We added machine learning. So in the computational neuroscience world, now the machine learning is where a computer takes your EEG and it reads it 2,000 times, and then it decomposes the entire record, and it can see things that you can't see. And so it's a real modern approach to looking at specific pieces of the data at specific locations within a three-dimensional mesh. And it says, here, right here, there's a signature here that's probably a problem. You might want to look at that.
Yeah.
And so that guides our hand very specifically in terms of how we should actually use neurostimulation to treat somebody, or neurofeedback in that matter. And then
Go ahead.
The other piece of precise medicine that we're using is called the event-related potential. And ERPs, for short, have been around for over 50 years. But with the computational neuroscience piece to it, now we can actually run ERP tests and look at how fast you process information and where in the brain is the bottleneck. Where are things slowing down, and where do we want to address that? So we designed some elements to that we add to the original brain mapping piece now. So we have these really precise medicine pieces that help us to make better treatment decisions that are reliable and valid and extremely important to help us measure the organ that we want to treat.
Can you talk about the difference between neurostimulation and neurofeedback, and why doing neurostim first can really help the brain open up so it can train better if that's indicated?
Yeah, for years I did neurofeedback, and neurofeedback definitely has clinical efficacy. I mean, the utility of it is very, very good. However, in the past, we've been creating neurostimulation devices for basically I don't know, almost 15 years now. And during that time, what we discovered was that we could stimulate the brain and get the brain to respond much faster than doing neurofeedback. And it was because that was almost an instantaneous response when you stimulate the brain, and then it would immediately start to entrain to the stimulation. The first questions we had was, I'm sorry, I missed you.
No, I'm listening. Go ahead.
Okay. The first things that we noticed was that the brain would respond to the stimulation, and then we were wondering, did it have a long-term impact? Was it just a short-term stimulation, and would it go away? And then we found that over a series of treatments that the brain would actually adopt the new stimulation speeds that we were giving it, and then it would actually correct itself, and it would turn into a longer-term response, which was just wonderful. So I think neurostimulation is far more effective than neurofeedback, simply because it's faster, and you get a treatment effect almost as quick as a medication in some cases.
Yeah, that's what we've discovered. Since we've been working with you and all your wonderful equipment, we frequently just do neurostimulation. We do sometimes add neurofeedback if we see the indication, but it's faster. It seems to be more effective, and we're just helping lots of people. So what kind of conditions would be ideal for this kind of therapy?
Well, we've looked at a lot of different things, in terms of what it can help. But people that have anxiety issues, they tend to respond very quickly to this kind of treatment. Sleep problems respond very quickly. People with depression, mood issues, they seem to respond very well to this. And the literature has been out for quite some time. We didn't invent this technology. It's been around in Europe, Canada, the UK, Japan, Australia. All of these countries have adopted neurostimulation, and there's a mountain of research that's been done showing the safety and efficacy of this form of treatment. Only in the United States are we behind the curve with this, and it's unfortunate that it's taken so long for it to get here. But in some ways it's great because all the groundwork's already been done. All the safety studies have been done showing that not only is it safe, but there's no significant adverse side effects as a result of doing a treatment like this. The most a person could experience is, fatigue. But it either works or it doesn't work, really.
Yeah, and we start our approach with any patient that calls us I see them first from a functional medicine perspective, because I got to find out, is there any other problem in the body that is informing the brain? Because we know that gut issues are directly connected to brain issues and vice versa. So, yeah, we've got to be sure that, their nutrition is good, their lifestyle factors are good, and any kind of nutritional or biochemical imbalances are evaluated and corrected, or else the brain work is not quite as effective. It doesn't mean it's not effective, but I just have found that approach to be so much more effective. Every time we've had somebody call and just kind of, oh, I want neurofeedback, and we I do it, and then we miss out on the rest of the body, and it's like, I'm not going to do that anymore. Now, tell about your work.
I completely agree with you. I think that the effectiveness of neurostimulation and neurofeedback is significantly impacted if the functional medicine piece is not addressed. Nutrition is and absorption and all the systemic functioning of the body really needs to be corrected before the brain can correct itself. Otherwise, the person will improve, and then they'll go right back to the way they were functioning.
Yeah, that's what we've discovered for sure. Now, tell a little bit about your work with traumatic brain injury, because we've got so many kids out there using their head to bounce their soccer ball or playing football or whatever, and they come in with a history of multiple concussions sometimes. So can you tell a little bit about your work with concussions, TBIs?
Sure. Yeah, we've worked with soldiers coming back from the war, kids that sustained injuries in football, early life injuries that result in brain damage, car accidents, you name it. I mean, we found it. So when you have somebody that sustained a traumatic brain injury, they're usually the last one to know how bad it is. Everybody else around them will know, and the family will know, and the spouse will know, and they'll say that there's a problem. And sometimes the person will say, I don't really see that. But then what happens is, especially with our soldiers, they come back from combat and they have a combination of trauma and a head injury, and they really don't know how bad it was. But they did their job for their country, and they sustained a major injury that impacts their ability to focus, to concentrate, to remain attentive to a job, to be able to go to work every day and maintain their job and do it correctly, to be a parent, basically.
Yeah.
And many of these poor souls end up, jumping into drugs and alcohol to self-medicate and to deal with whatever's happening up there, and they don't know. Again, when you sustain an injury like that, you're the last one to know how bad it is until you actually start to get treated. And then when you start to generate insight into yourself again, then you realize, oh my God, I was able to do this, and now I'm just starting to relearn that. You have to relearn everything, And so we do a lot of treatment with people using neurostimulation. We do the same procedures with our QEEG mapping. We identify portions of the brain that are generating a whole bunch of slow wave activity in the delta range, which is usually indicative of white matter damage in the brain. And so, like for instance, when we get these soldiers that did room clearings in Iraq, right, and they went through there and they would squirt silly string into the room to detonate any traps in the room, and these dirty bombs would go off in the room, and everybody would get knocked down from a concussion blast, and then they get up and just kind of wipe themselves off, and then just go to the next room and do it again. And in one day, they may sustain 10 to 15 concussion blasts, and then go back to the barracks and think everything's fine. And then it wasn't until we started to get some people going completely out of their mind that the U.S. military went, oh my God, we got to have sensors in the helmet to determine, you suffered a blast, and now it automatically sends them in to get screened by a neurologist. Before that wasn't there, and so the estimation was like almost 150,000 people suffered those kinds of injuries during the war. It's mind-blowing to think about, and that's not, obviously it's a small segment of the population, but this is, a significant problem,
Yeah.
And when you look at sports, football, soccer. Soccer's the number one sport for traumatic brain injury when they head the ball. You know?
Yeah, I know. It's hard to get kids and their parents to understand that. So we do now understand that repeated concussions can lead to early dementia. So can you, and we're also learning that we can turn around dementia, even Alzheimer's, with a very broad approach, okay? And one of the ways would be to not only look at them from a holistic perspective, but to do neurostim. Have you worked with a lot of, I'll say, dementia or early Alzheimer's patients?
Yeah, I have. And sadly, one of the populations that comes to mind is professional football players.
Oh, yeah.
These individuals come in, and I've seen many NFL players that played the game for around 10 years. And, we're talking about, 250 to 350 pound guys that can run extremely fast and go head on with another guy that's doing the thing. And it's like two Mack trucks hitting each other. And they sustained multiple concussions over those periods of time.
Mm-hmm.
And when we would get them, by the time we get them in treatment, they're forgetting things, they're difficulty with concentration, they have difficulty reading and comprehending what they're reading. Sometimes they have word finding issues. Sometimes they have issues with just simply being able to speak and formulate words. Forgetting a good deal of their day. Those are a lot of the symptoms that we see when they walk through the door. So those populations we definitely have seen, and neurostimulation is like physical therapy for the brain. When we do our initial measurements, we figure out where that issue is, and then we're going to put those sensors on the brain and start to stimulate that portion of the brain. It's kind of like putting your brain on a treadmill. We can turn it up, and we gently start a person. We don't go really intensive at first. We gradually ramp them up to speed so they can get stronger. And then, and the brain is smart. The brain knows how to heal itself. It engages in neurosis where dead cells are taken out by the vascular system, and new cells grow into that system, and then they incorporate themselves back into the neural network. And then, so the brain's this brilliant doctor. It knows how to heal itself. And if we just use really, smart ways of approaching it, we can help encourage that process, which is, I think, the combination of what we both do in terms of neurostimulation and functional medicine, giving it the fuel that it needs to run correctly, along with, exercising it in such a way. And and the real trick is finding where that needle in the haystack is. I think that the latest estimates from in neuroscience indicate there's roughly 86 billion neurons in your brain with roughly 100 trillion synaptic connections. That in a single second, the brain will fire off roughly 7 quadrillion events per second.
I know it's the most amazing. Well, all the body is amazing, but that's why I wanted to incorporate this kind of therapy into our practice, because I would say 70% of the people that I see suffer from brain fog or anxiety, depression, insomnia, and we frequently encourage an EEG. And I've gotten to the point, Nick, that I think everybody should have an EEG. We check their cholesterol and all kind of other things, and nobody ever thinks about doing an EEG. But it's part of a good wellness workup. And then if a problem occurs later, you could go back and repeat the EEG and say, yeah, this was looking good 3 years ago, but now look what has happened because of XYZ. So, it's such an important part of health. And I just keep drumming it into my patient's head. And one thing people think, oh, is it going to hurt? and we use such tiny amount of stimulation. Can you talk about the safety of neurostimulation?
Oh, sure. Yeah. And that's always a concern, because people think about, if they talk about electrical stimulation, they think electroconvulsive therapy,
I
and they
know.
start to go back in time and think about, real shock therapy to the brain. And, that's a method that's really solely in the ballpark of psychiatry, which
Mhm.
we don't go to. And, electroconvulsive therapy uses anywhere between 400 to 800 milliamps of stimulation, 400 to 800. And the stimulation we use, the maximum is 2.5 milliamps. And what the
Tiny.
research will show you, tiny electrical stimulation, but the research clearly points out that 1.5 to 2.5 milliamps of electrical stimulation is not only safe with no significant adverse side effects, but it also can significantly treat the symptoms of depression, and it can do it quickly. And so that's what the research says. Those are meta-analysis say.
Yeah.
Now the safety studies, the latest safety study that I read is a meta-analysis that looks at 145 electrical stimulation studies, and looked at all 145 of them with over 4,000 participants. And they said that not only was it safe, but again, no significant adverse side effects for multiple populations in multiple age ranges. So
Yeah.
the jury is out with whether or not it's safe. It's been deemed safe, and it's obvious that the data really shows that. Now it's down to the types that we use, and the methods that we use in that paradigm. So
Yeah.
yeah, the safety is there for sure.
The thing that amazes me about you is that you're constantly evolving. You're researching, you're trying, you do a little adjustment to the equipment, you come out with a new set of parameters, and it's sometimes hard to keep up with you, but we do our best. So you go around the world training, health professionals in doing this kind of work. You have been, God, how many countries have you trained in? People in?
Quite a few, yeah. It's been we've been fortunate in that way, to be able to travel around and meet some of the coolest people I've ever met in my life. And be able, they're very interested in helping their patients. And the cool thing about it is, I genuinely am inspired, and I enjoy this, and I feel like it's my mission to
Yeah.
spread the word about this. I mean, my own son, actually today, he's graduating, and he graduated with a A average, and he's going into engineering, and he got into a university, and he's doing great. And that was the reason I did it as a parent. I was terrified to see what would happen to my son, and 18 years later, he's healed. And had we not been able to give him that type of treatment, this would have been a markedly different life for this person. And
Yeah.
and so that's why we do what we do. And it's because this impacts lives in a way where people always say to me, like, what does this really do? And if I had to boil it down to one word, it would be functionality.
Yeah.
Your brain becomes functional. And when you become functional, then you can learn, you can do things, you can engage. And these are the things that inspire me and motivate me to create and innovate. So yeah, we're doing stuff now that is so interesting to me. I think we're hitting another zeitgeist in the
Mhm.
neuroscience world. We recently put together a new paradigm where we combine what's called pink noise with specific frequencies. We call them combo protocols. And
Mhm.
the brain is a pink noise generator. The background or kind of the operating system of the brain is pink noise. And we figured out a way to be able to deliver pink noise to the system. And when you do, what happens is that the system regulates itself. It absorbs it. It uses it. You know, the brain in its randomness can find the signal in the noise. And we found that when we actually give this, and it's profound. The implications are profound because it corrects itself faster. And so I wear a lot of hats, right? And one of the hats I wear is a director of neuroscience for a place called FHE Health in Florida. And it's an addiction mental health facility where we have about 180 patients there. And we have 7 neuro labs going day in and day out. And these are people that, you know, we get people with opioid addiction and really significant alcoholism or stimulant problems. And we found that by giving the pink noise to the pain network, it would stabilize them while they went through their medical detox. The other day we were sitting in a meeting with the insurance companies, and they were saying, you know, you guys have an AMA rate of less than 4%. How did you do that? You're at 3.8% for a medical facility that does detox, and it's just unheard of. And they're genuinely interested because these people, when they started to track them, they realized, wait a minute, these guys aren't taxing our system the way they did before, and they went through this treat. You know, what are you guys doing differently that other systems aren't? And we combined the neurostimulation with legitimate medical treatment to stabilize somebody, and we found that they stayed in treatment.
You just have to pull everything you know into helping people get well and do it in an effective, safe way. You know, I wish every doctor had even just some of the simple programs that we have. We don't have every bell and whistle yet, okay? When Tom gets over his last few weeks of school as a nurse practitioner, we'll hopefully ramp up our neurotherapy program here. But is there anything else you want to tell us about that you think all these wonderful people should know about their brain and why it's so important to keep it healthy?
Absolutely. I could talk for days on that. I think if I would want to get across any message, it would be that don't lose hope. There's a lot of times people get presented with different kinds of issues neurologically that when they go to their regular standard physician that doesn't have knowledge about what is really happening in the neuroscience world, they get handed a diagnosis and a sentence that is really brutal. And a lot of times it leads to unnecessary misery. And there's so many ways now of being able to address some pretty significant issues to help a person to rehabilitate, to get stronger, to be able to function better. And yeah, they're not perfect. Everything is constantly evolving, everything's changing, but don't lose hope. Don't necessarily accept the status quo when you hear that this is the only thing that's going to help you. Because, I think a lot of times people don't get the information they need.
Absolutely. And that's why I'm doing all these interviews so that people can hear about all the wonderful people who are doing so many amazing things like you and your lovely wife, Tiff Thompson, who is also very much evolving into this whole arena. And I'm so glad that your elder son has graduated. That is so cool. Starting from what he was, a 2-pounder. He was really premature, and that was your impetus to really go deep in this field and help him, and you sure did. So if people want to find out more about you, how would they get in touch with you? I want to put that in the
They can email me at Dr. Dogris at neurofieldneurotherapy.com, DRDOGRIS
I'm
at
trying to
neuro.
put that. Wait, I'm not able to put. I'll put it in later. It's not working. Okay, I'll put it. I'll put in your contact information and your website. Okay, and if anybody has any questions, of course you can post them, and I'll do my best to answer them. But anyway, this has been such a delight. We can talk much longer. I don't want to keep you from your important work, but I greatly appreciate it, and maybe we can do it again sometime later and just focus in on another area of why and how this therapy can be so impactful for people. Okay?
Absolutely. I'm more than happy. Thank you for having me on. I really appreciate it. Thank you for the work that you do as well. So it all works together.
Yeah, we make a good team. All right. Okay. So we'll see you later.